Hi, my name is Fabiola. I'm going to be doing my perceptual voice analysis project. I decided to do my project on Kathleen Turner. She is an American actor, activist, and professor, and she is currently age 71. This is the video I chose.
I was told I'd be in a wheelchair the rest of my life because of rheumatoid arthritis, and at that time, 20-some years ago, they had none of the medications that we have now that were created about 18 years ago. I think we had our first biologic. They would hire a drunk. They would hire somebody that's a drunk because they figured they could control them. But someone with a disease they did not understand is very frightening to them. So I couldn't, things like if my hand couldn't hold a mug and it would slip, they go, oh, as though I'd been drinking or something because I dropped the glass. No, it's because my hand won't hold it. No, I've had to have joints replaced.
All right, so for my Kate V, I gave Kathleen an overall severity of 45/100. For roughness, it was a 64/100. So I noticed a lot of hard onset. Her low frequency was very apparent. So I also heard some hard and abrupt glottal attacks. Some mild breathiness, so I scored that a 20 out of 100. Breathiness only because of like reduced subglottal pressure near the end of her sentences or phrases. It sounds kind of like airy as she releases sound. Sort of sounds almost as if she needs to take greater breaths between phrases in order to sustain long phrases and keep the flow of the conversation. So for strain, more on the more severity level, so that was a score of 70/100. You can hear some tightening of her vocal folds and also some tension. So that's why I decided to score strain a little higher. For pitch, she has a perceptually low pitch relative to like other women. So she has more of like a baritone sound, which is typically for like about a male range voice. So she may be potentially overvalving. So that was a score of 85/100. For loudness, I would say she has good vocal control and projection. So there wasn't a lot of disparity on her vocal loudness. So that was a very low score of 7/100. I forgot to mark it, but she's consistent in all of her parameters, except for breathiness. Breathiness sounds a little bit more intermittent than the others. For resonance, I said that she had deep resonance. So perceptually, she really sounds like she's using more of like her chest cavity in order to like project sound and project voice. Additional features that I noticed were a glottal fry because of the low fundamental frequency and the potential of irregular vibrations of the vocal folds. There was apparent raspy, so a textured and rough and harshness quality of voice. Yeah, so this is my Kate V. Moving on to the summary of my Kate V. So overall, Kathleen is known for her distinctive, deep, raspy voice. The roughness in her voice is consistent and may be due to abrupt glottal attacks and hard onset, but she remains very intelligible when she speaks. At the end of Kathleen's phrases, perceptually, it sounds airy, almost as if she needs to take greater breaths between phrases to sustain a long phrase and keep the flow of the conversation. She has a notable degree of strain, sounding very hoarse rather than smooth or effortless. Kathleen also has a low pitch or fundamental frequency, especially for a female voice, which she's known for as an actress. And she also seems to have reasonable vocal control and projection with suitable loudness for everyday speech. Like I mentioned, additional features include glottal fry, since it is the lowest of the 3 vocal registers in voice, and Kathleen's voice is deep and low pitched. Alright, so if I were to scope and stroke Kathleen, we would likely find the following things based on her aging voice: so presbyphonia, years of smoking, alcohol consumption, and her diagnosis of rheumatoid arthritis. So, what would I look for? I would look for structural lesions, specifically vocal nodules and polyps. So, if I were to find these, I would see a mass or growth, which can cause irregularity in the mucosal wave, reduce amplitude and periodicity, and the weight of the lesion can lower the pitch of the voice. Next, either I would look for chronic inflammation or edema, so specifically increased vocal fold mass. An increased mass of swollen vocal folds would result in decreased fundamental frequency, which would cause the low pitch in her voice. Possible asymmetry in the vibration pattern of the vocal folds can also be found due to uneven swelling and stiffness, which can contribute to roughness we also hear in her voice. Moreover, I would look for muscle tension dysphonia, so specifically hyperfunctioning and overvalving. With this, it would be due to excessive tension and muscle activity. So the false vocal folds or the ventricular folds and other laryngeal muscles will become tired and present some strain. Also, aging voice, so specifically atrophy and bowing. So maybe some incomplete glottic closure during speech will possibly allow that some air to escape and contribute to the breath equality that I mentioned before. All right, so these are just specifically what I would find when strobing. So if I were to find vocal nodules or polyps, these would be found on the edge of the vocal folds, typically at the juncture of the anterior 1/3 and posterior 2/3. For inflammation and edema, the vocal folds may appear swollen along their entire length due to irritation. And then muscle tension dysphonia, we would have the excessive laryngeal muscle tension and hyperadduction. So a lot of that hypervalving and then causing strain. Presbyphonia would cause the laryngeal muscle atrophy and bowing, so thinning of the vocal folds, and would possibly cause that incomplete glottic closure, creating that subglottic pressure, and so not enough closure, so it would cause breath to go up and cause that breathy quality that we hear. Therefore, Kathleen Turner has a medical diagnosis of rheumatoid arthritis, which can affect the larynx and small joints of the head and neck. More specifically, it can cause inflammation and impair the mobility of the vocal folds, as evidenced by the mucosal wave and fold movement. There may be swelling of the larynx, and nodules can also occur in patients with active rheumatoid arthritis. She may be using her voice in a way that shows signs of hyperfunction or muscle tension, giving her voice that glottal fry effects. All right, that is the end of my presentation for my perceptual voice analysis project on Kathleen Turner. Thank you. And these are my references. Thank you.